Joyce, any suggestion from the health perspective?
I'm looking at it in terms of long term, because when we have the expertise who come in just for a short time and they go, that is expensive. I think countries should invest in healthcare. We should invest in health systems so that when such things happen, they're able to navigate without a problem. Because right now we are seeing a lot of unpreparedness, and therefore that is why I think Raymond would suggest we have like task forces. But imagine if we had like systems where we took care, because epidemics, pandemics happen, outbreaks happen in countries. But do we only want to act when they happen, or do we want to prepare for them? So I think we should look, as much as we are now looking at it in terms of what do we do to help our countries navigate through, but also we should start thinking on how to have strong health systems that can withstand anything that comes their way.
Well, would that be trying to have, let's say, a political will, or would that mean that to have, let's say, a strong constitution in a particular country that will outline the number of investment a country have to do in terms of like strengthening the healthcare system, in terms of like training the medical personnel in that particular country, in terms of establishing the necessary infrastructure in that particular country? Is that what you mean?
Yes, but you see, if you read our constitutions, most of our constitutions have clear structures. Most of our countries have clear policies on how to tackle these things. But it's just the implementation part. And that one, I think it's more of a political will and integrity, because when we get to that point where we have to seek for services, which is our right, then it beats the constitution. Because in the constitution, I know healthcare is a human right thing, like in my country. Healthcare is a human right issue, and therefore everybody is entitled to have it. But how far? You see, and that how far depends on the political will that is in place, depends on the government in place.
Interesting. Yes. It seems like Hadir is part of us here. If that's so, Hadir, from the political ecology point of view, what do you want to add onto that?
Hi, Ahmad, and hi, everyone. I'm sorry, from which point of view?
From the political ecology point of view, let's say talking about constitution or having a strong political will in addressing this kind of situation, what will be your take on that?
Okay, as everyone, everything is just like still so vague, even in terms of political or non-political aspects of this emergency. But I was just reading something today that was very interesting. It says that in cases like emergency, like COVID, the trafficking or the smuggling is actually on a strike because people use, they always use like things in a different way, and there is a lot of jeopardy in terms of, especially with refugee camps and settlements and shelters. But I would love actually like to use like today's meeting to learn more and listen more if we have colleagues from the MS, as Joyce was speaking, and Raymond, because I would love to know, like in terms of preparedness, are we talking about preparedness for emergencies, or are we talking on preparedness on the long term? For example, in Egypt, it has been quite better than, for example, in the US. I'm not sure, is that because the numbers are less or numbers of infected cases are less? But I like everything, even like with the transparency of transmitting the information, it has also been, they have been doing a great job. This is something that's also very essential. Like, is it the transparency of translating the information in different African countries? To what extent has it been helpful for people?
Yes, that sounds very good, because what I have seen so far on the social media and on the news bulletin is every African country is acting in isolation. All of them are doing things single-handedly, like Gambia, Senegal, all of them are doing things in isolation. But some policy recommendations are, since it's a global pandemic, can countries forge partnership to address this situation? So to how far countries can achieve that kind of partnership to address the pandemic is not clear. It's kind of very vague, like you already mentioned.
Okay, Omar, I don't know, because our country contexts are different. So therefore, what kind of partnership are you talking about in terms of managing COVID-19, for example?
Partnerships will be like, if you look at most of the countries, there is inter-country migration, people traveling from Europe to other part of the world. People traveling from hotspot COVID-19 centers going to other part of the world. So if they arrive down there, what kind of let's say resource sharing, what kind of information sharing, what kind of technical expertise, knowledge sharing is countries trying to collaborate to be able to be open enough about their healthcare system? What kind of equipment do they have? What kind of preventive measures do they have in their healthcare system?
Okay, can I come in? Hello?
Yes, Mr. Raymond, yes.
Okay, so I would like to speak focusing on Southern Africa, and that is just to pull out two countries' responses, Zimbabwe and South Africa. So for South Africa, for example, they have instituted a 21-day stay-at-home kind of advisory, more like what we have here. Of course, 21-day lockdown, maybe in that part of the world. And so this is the big face to the response to COVID. And we are not so much told of the underlying, the accompanying health practices or health responses that are also accompanying that 21-day, because people may be locked out for 21 days, and if there's no accompanying health provisions to say the sanitizers, facilities to treat people who have been diagnosed, and so forth, then that effort might not yield as much results as desired. And then I look at a country like Zimbabwe, where I think there was a discussion on, I think it should be March 31st. That's when the 21-day also, a similar kind of an approach is also going to be implemented in the country. But if you look at some of the developments that have been happening in the healthcare system, for example, nurses and doctors are going on strike because they were saying, this was according to the Zimbabwe Nurses Association. They were saying their members, and the Zimbabwe Nurses Association is like a representative body of nurses and doctors in the country. So they were actually proposing that they have to stop working because they made a certain list, they made it some demands, and I think the government was not yielding. So you can see that even the response itself is kind of looks like it's compromised from the start. Because if you have one section of the first responders, and these are the nurses and the doctors, and they are saying, if we don't have the equipment to use, the protective clothing to use, we are not going to address this situation. And there are even reports that some people have been turned away from hospitals, those who have been showing like symptoms like that. So you find that these are all challenges. And now if you try to look at, is Zimbabwe in a position to share information with South Africa, then that can be problematic, because as a start, the country itself is even struggling to formulate its own response to the pandemic.
Yeah. Okay, Francis.
Yes. Thank you so much, Omar, for instituting this platform. I wanted to speak concerning maybe what I've seen happening in Uganda and the understanding or how people took this crisis is that we have at least 3 different people to that are that have the obligation, if I may use that word, to do something, and that is those one that falls under the Ministry of Health, then the executives, then the local population. Now, those one that fall under the Ministry of Health, medical practitioners and everything, they're doing all that they can in order to help the situation. Now, what the executives is doing, they have come out with this idea of absolute lockdown, right? But then because, people, when they're locked down, living becomes so difficult because sometimes, like for an ordinary person out there, survive on a daily sale of things, So what the citizen did is that, okay, now it is an absolute lockdown. What do you have and what can you give, right? So, so if you are, sorry, I was being loud. So the farmers, what the farmers are doing, they're cutting their crops from the garden and they're saying, okay, let's give it to these people who does not have. Now we have, I don't know how to, bordermen, those who ride motorcycle, right? So the bordermen are saying, all right, you know what, we are not working now, but we have motorcycle at home. What do we need? Let you get for us fuel. You put fuel in our bike. We will distribute food to the people, right? Now there was all think of the this face mask thing, right? Yeah. Now people they sat down and like, all right, what can we do to maybe invent like face masks? Now what they do, it's still in the process of testing to see how effective it is. They have started making face masks, like the inner side is made out of closed material like this, but then the outer cover is made out of, these plastic bottles. So I thought it was a very, very effective because people are not saying you have to do this. Everybody's like, it started with me. You see it happening, you joined us. So I think that's something that I would think could be very helpful.
Thank you so much, Francis. You touched down on one important key element here, which is the issue of inequality. Like some people, when you mention about lockdown, where do they have their livelihood? If they happen to rely on daily transaction of going to the local market, going to their farm, if you say 21 days, 1 week, 2 weeks, lockdown, how are they going to survive? In a country that does not have essential social service structures, like let's say they don't have supermarket, they don't have let's say shopping centers, for them to have the money of buying groceries to stock those groceries in their houses. This is the case in most African countries. People live from hand to mouth, like they only have let's say a couple of days food stock in their houses. And after that couple of days, they have to go outside to look for something else. So if we say, let's have a lockdown, let's promote social distancing, what is the day like for those people? What is at least the hope for these people? So if anybody want to add into that one, that'd be very important too for us to discuss on that. It's of inequality between the African people and let's say the underprivileged people.
Omar, can I add something?
Yes.
Yeah, and I think that is why, if you look at my country, Kenya, that is why even the curfew cannot work.
Right.
Because they're saying, first of all, we live in a 10 by 10 room, 5 of us. We share bathroom, we share toilets. We have to leave every morning to go and look for something to eat.
Yes.
And then you tell us that we have to be back home by 7. No one should be outside by 7. And yet we have to close our markets or our businesses by 6, or even like in the evening when people are going home, that is when we sell. So really, what are we supposed to do? Are we supposed to sit home and die of hunger, or are we supposed to go out there and risk our life and die from COVID? Because at the end of the day, we are gonna die anyway.
Well, George, that's a sad story. Do you want to add something on that one, or Raymond or Nanko or Muyaza? Do you guys want to add on that inequality dimension of COVID-19 social distancing or lockdown? Also, people go about with their normal daily lives. If they happen to get the COVID-19, then that's it.
Thank you, Omar. Like, I want to add something about the inequality part. Like, in Africa, I think like this COVID-19 will have more harm about the economic side rather than the people losing their lives, you know. Since we have a younger population, like the risk of many people dying about COVID-19 due to health will be lower compared to the economic side. So as in the case in my country, we had our first cases last week, and the cases were coming from our own expats living in France. So they bring the COVID-19, and the government could not lock like the border because they are national. You cannot say no, you cannot come back home. So when they came back, they couldn't do the proper.
Well, it seems that we are losing Nanko there. Does somebody want to go on
So
before
those
Nanko?
people,
Okay.
they don't have anything.
Okay,
they don't have anything to do now. And the government so far, they don't have any plans like to provide some incomes or some kind of relief to those people who are vulnerable. We have some organizations who are trying to help people living outside who don't have like any house to go, poor people who are vulnerable, by providing them food, like shelter and hand sanitizer. But I feel like even those are not enough because we don't know how long this pandemic will start. And the worst thing is like next month we have Ramadan coming. People are going to be fasting. And right now the prices are increasing so highly that the government needs, for me, I feel like the government needs to do some kind of price, like they will require the vendor to keep the price as low as possible until like we find some kind of solution. Like the price of the food that are required for people, like their basic needs, you know, like hand sanitizer, all those stuff, the price, when you want to look for them now, it's like the double or triple the price. And for food, same. So like they need to make anything possible to put the price of foods down and provide people with some kind of alternatives, since like we don't have any capacity to let people work from home, and most of the jobs that are being done in Africa is like from person to person. So like that's what I think about this situation.
Any other contribution on the aspect of inequality from other perspectives or from other part of the world?
Hello, Omar.
Yes.
Sorry, Raymond. Raymond.
Okay.
I just want to say that some of the people cannot get access, so I'm just like trying to send them the other link that Nango posted. Just we're trying to figure out like why it's not, because some people said it's asking them for a meeting password. So just a disclaimer.
All right, Mr. Raymond, you can go ahead now, please.
Okay, so just to on the inequality part, so I think yes, it's a very big concern in terms of who can have access to premier healthcare services within a country. And for our African countries, we know that for the most part, it is the elite. It is those who have a bigger financial muscle, so to speak. But then if you look at the other unfolding characteristics about and other unfolding observations, what we are learning from the media, from different sources, initially we kind of thought it was for the elderly, people who are old, who have other underlying health issues. But from what is being reported, hello? Okay. Sorry, I think my line just cut off there. So from what we can see now, it's now everyone on the spectrum from 0 up to as many years as you want. So there are people who have been healthier. They don't have any health history, of some disease of any sort, and they've also been affected. So for developing countries, I think the inequality issue may not play a very big role, but actually what might be at stake is the quality of the healthcare system in a particular country, and what the government or what the service providers are doing as a response to the pandemic.
Yes, that is quite right, Mr. Raymond. One thing, we need to have at least a robust healthcare system that can take care of the demand of the citizens. But then the other thing is there are people, even if we have the robust or if we have a strong healthcare system in a particular country, some set of the population cannot afford that healthcare payment. And then there are certain percentage of the people whom that they have to go about with their daily activities to be able to bring meal on the table.
Yes, I agree.
Yes. So if we talk about lockdown here, what kind of provision are we going to have for those people?
Well, I'm not trying to differ here. This is Will. I think on one hand, it's not about the health. Before you get to the healthcare situation, before you all need healthcare, it was at a point where decision-making was not as quick as it should have been. And it's not just, the US, the Africa, but even in the US. But I think for African governments, a lot of decision-making dragged along because they lacked medical research or people who are responsible for warning the countries of what's coming, being able to give objective information on what's coming. We do not know who these African governments are relying on for information. Are they relying on their individual countries' medical research institutes? Are they relying on doctors? Are they relying on the international media? Which is my instinct is most of them are relying on international media to make decisions, and then they use what the media is saying people should do, then using that as the policymaker. So I think beyond what the hospitals can do, but also going back to the question of preparedness.
Can I just say a quick thought about the informal economies and not the contradiction, but what Francis has said and how people sometimes use their own creativity in responding to certain emergencies. And also what Joyce said is that how are people going to survive? People who live on day-by-day income. And I believe that most of the African countries, I'm sure that most of the African countries, if not 60-70% of them, they survive on informal economies. So for example, in Egypt, it's the curfew has been implemented from 7 p.m. till 6 a.m. But people who live the dwellers and people who live on selling things on the street markets, have been very, very afraid to not abide by the laws or the policies. But how they are surviving if they're not selling what they got, and these are farmers, they get what they have and they go on a train and then go to the city and sell those stuff. Some of the, I don't know, there was no policy that was implemented by the government to address that issue. But certain charities and people who are usually the donors for individual donors that give for religious reasons, like because we are almost approaching Ramadan. And so people are now trying to interact more and donating more to people who have less resources. I don't know if that happens, like if that is like a social responsibility is always active in all of the countries. But in times like this, it's usually, we don't expect much from the government. So like, yeah, the government has been very, very well with responding to the healthcare procedures in the country, but not necessarily the economic policies. And I feel like it's always take this and not that. There's always the gap, you know.
Interesting. Anybody want to add into that? Looking at the informal sector and also as well as contribute on the issue of economic policy, how can countries recover their economy after the post COVID-19? Bola. Oh, Francis, you want to go ahead?
Yeah, thank you. I want to there is a point on the absolute lockdown we talked about earlier. But one, I think that the context could be different, you know, but for the most part, when they said lockdown, it's, for example, let's say transporting food stuff, you are allowed to do that, right? But then let's say going in to do a daily thing, that is what is not allowed. Now, I think the best measure is this lockdown, because the reality is the health facilities, technically in all African countries, cannot support, let's say, treating coronavirus or this epidemic. Now, the whole idea of locking everything down and to prevent rather than treating, I think that is, at this point, I would say it is the safest way possible. Now, how does that lockdown play when it comes to economic inequalities? Now, we're talking about elites having money, but then we also realize that those who are not elites actually have foodstuff in the market, right? I mean, not in the market, in their garden. Different, but what we have seen, at least from other, am I frozen?
Go ahead.
Okay, at least what we have seen from, let's say, my context, my country's context, is that we're now saying, all right, we need to get out of our normal comfort lifestyle, okay? Now, if the matter is surviving, what do we need to survive, right? We need food. Okay, if your problem is only food, now people are saying, I really don't have anything, but I can provide you with food, you know? So those who have food, they are giving food. Those who cannot, like for example, one of the hotel in Gulu, they said, all right, we're not working, we will cook food, but they will come and get cooked food served, like you get, everybody at least get a plate, you know? So I think that will bridge the survival gap. Now, how is that going to affect the economy? In Uganda, we have things like mobile money, where you transact via phone. We have the NSSF, you know, like the National Social Security Fund. All those kind of things attracts, you know, the transaction attracts money, right? Mm-hmm. So now what happened is they said, for example, I mean, most of the people bank their money using mobile money. So they said, we are going to withdraw, to cut any tax out of that money, any service fee that you pay, to encourage you to continue transacting via your phone without actually paying anything. Now, things like electricity and water, they said, at this point, you need electricity and water more than anything else. We are going to cut, like for example, like electricity, they said, whether you pay it or not, we are not going to, cut off power. We want you to run, So I think at least we can see that there is, it could affect, and it's going to affect, but I think at the end of it all, if you are alive, there is a possibility that you can get back on your feet. But if you died, there is a 100% chance you can never get back on your feet. So I guess at this point, it's like survival first.
Interesting. Any other contribution from other colleagues here? Lucian is here, Bola from.
Hi, this is Bola.
Yeah.
Hi, Umar. Hi, guys. So I think just to understand I think we're talking about the economical impact that this might have on a lot of countries, right? Is that what we're talking about?
We look at things from economic point of view. We look at things from inequality between the rich people in a particular country or between the wealthy nations and less developed countries. Both inter-country dimension, I'm looking at things across countries. If you say a lockdown, how is that going to affect different countries? If you say a lockdown in a particular country, how is that going to affect the rich people and the poor people in that particular country? What kind of strategies does governments need to bounce back after COVID-19?
Okay. Just for me, for now, like I would like to focus on the immediate need that I think we need right now, which is not necessarily how we're going to come back in terms of economy right now. I think for me right now, I think the most important thing we need is actually testing. Like in a lot of African countries, the numbers are so low, right? Which is supposed to be a good news. But the danger of that is the numbers are low because the people are not getting tested.
Oh.
In Nigeria, for instance, a lot of people that have been discovered to have it are influential people. I got saw a news today that another governor in Nigeria has it. So it's like usually the influential people that have been tested, not necessarily the average people. So we might be excited that the numbers are not that high, they're low, but it doesn't necessarily mean that's the reality of what's going on there, right? So in terms of like telling people to stay at home, for me, I feel like that's going to be hard. I can't speak for every other African countries, but for Nigeria, for instance, I feel like that's going to be hard because the culture is like people live in a community. They don't live by themselves in most cases. In America, it's so easy to do social isolation. I feel like in Nigeria, it's going to be really difficult because even on your street, you have like how many people living on one street, especially if you live in Lagos. It's a very population dense city. So even though when you tell people to stay at home, staying at home doesn't necessarily mean they don't have contact with other people. That doesn't mean they don't have access with other people. And then we talk about especially people from poor communities or like from lower income household where they have to buy food. Not everybody can afford to buy food for a week or 2 weeks or 1 month. A lot of people can only afford to buy daily food that they can consume, which means they have to go out to go buy food, which is not necessarily a safe thing to do. So putting all those together, I think Lagos State, I know Lagos State they've started like doing some food delivering something. I don't know how effective that's going to be, but I feel like that's actually a good start in terms of like at least making sure that people have enough to eat. Because I feel like if you want to tell people to stay at home, you better make sure they have something to eat. Because if they don't have anything to eat, nobody's going to stay at home. Will.
Sorry to cut you off, but the question is, do you think governments have capacity to feed people who are quarantined? And that's like, for me, it's a trick question because I think they are, but also do you think they can or they want to?
Well, can I say something from the public health perspective? The reason why we are told to stay at home is just for one reason, so that we can be able to cut the transmission, further transmission. Yes, we do not have capacities of testing in Africa, and that is why we're saying that when people stay at home for the 2 weeks, for the 14 days, we can be able to pick up the number of people who have the infection and deal with them, and therefore maybe cut the transmission. So that is the essence of telling people to stay at home and not interact further. Yes, we know that there's a problem in terms of what are they going to eat when they stay at home. But in that case, you say, like the way you've said, countries are trying to look for modalities of how to provide food, for example, to the low-income earners who cannot have food. So we're just saying that please stay at home for the 2 weeks. Let's see the extent of the spread, because we cannot test the whole population. It is not economical to test the whole population.
Yeah, Joyce, I agree with you, and I understand why they say people should stay at home, and I think staying at home will help a lot. But what I'm saying is that it's easier said than done. Like, if you tell me to stay at home, if I have food at home, I'll stay at home. I don't have anywhere to go to. But if I don't have food at home, even if I want to stay at home, I can't stay at home because I have to find something to eat.
Bola, and I'm coming back and saying, some people will steal, and you ask them why they stole, they'll say, I stole because I'm a thief, you know? And that's not a good excuse. So the point is, African governments can say, oh, you should stay at home and because you don't want to, you should not get the virus. But can they actually, governments do they have the budgetary capacity and operational capacity to give food to 5 million people living in the Kibera slums, or people living in Durban, in South Africa? Do governments have the capacity, and do they have in the preparedness to be able to meet something like an emergency like this?
I'd like to say, and that is why I said when we started that this whole thing does not need a short-term solution. It needs a long-term solution. And therefore, we need to look at our country's policies and constitutions. Yes, we have constitutions which are well written, but are they implemented? We have emergencies funds, for example. Every country, I'm sure they have an emergency kit. But what does that money do? The money, if used well, it can be able to take care of the emergencies we are having right now. But that is just when we have a political will, when we have good governance, when we have leaders who are forward-looking and not just self-centered.
Yeah, Joyce, I completely agree with you. I think you answered Will's question there. In terms of if we have the resources, I think we have the resources to actually feed those people. If the question is, I don't know if we have the will, or if our leaders have the will to do those things. I mean, during this corona, there's Nigerian House of Representatives trying to go buy some expensive cars when they should be feeding people. So, like, there are a lot of things that if we put our resources into the right places, there are solutions that we can solve. But the question is, are our leaders willing to do those things? That's a question I don't think I have an answer to.
Well, Bola, for that question, exactly, it's difficult to answer, but if people are kind of rational, or maybe they use their brain, like here, we don't have any choice, because if you don't do anything, so it's gonna be bad for all of us. So and the thing is, for the resources, I think we need to be, I don't know how to put it, effective in using it. Some government, they differ from sizes. So we have in countries, people who are super rich, they can contribute to help the government provide food for people who are in most cases, who are the most vulnerable. People can be identified, and from that, they can be put on the list so that they can be taken care of easily. And for the food production, if you say to people to stay home, as you said, it's going to be difficult because they need to go get food. But if you maintain like the market open, which is kind of populated in Africa, you need to take precaution to make sure that people are, in safe distances or are practicing the guidelines to prevent this spreading of the virus, which is also difficult. So you need to find places where people can go and get food, and at the same time they can stay home, which is kind of tricky. But like, I feel like if they want to do something about it, they can find a solution to do it. Right now, all the schools are closed. Schools can be used to provide food from people other places than the market. They can split people to go to schools and provide food from there. Like, it's not gonna be only one place where people can go and get food, but we can be creative. That's what I feel like. Hotels are being used to provide food. Hotels are being used to provide health care. So why not use some buildings that are not being used to provide all those services that are required for people instead of focusing only in one places, That's what I think about it.
And also I'm thinking in terms of what a good point of children at home, schools are closed, so we can use the schools to do some of that work. And remember, the children we have now back home usually get their meals from school. So what if the government decides the meals that they were giving children during their school time, they still continue providing those meals, so that the people who cannot afford, who say that they are going out to look for food, then they can be able to get something to feed their children on, so that we see if really we can be able to just have a simple lockdown that will save many lives in future.
Well, we'll have types on few things here, like how is the role of the corporate bodies in this kind of situation? How about Dangote? Let's talk about Dangote's industries. How can they help government and people in this kind of pandemics? Maybe some people who have an idea about the corporate industry or the corporate world can make some contribution, or any personal opinion about that.
Okay, sorry. What do you mean by corporate industry? All the
so
companies.
The corporate world, like let's say with banks, insurance companies, be able to do some investments, so they invest more in this, like let's say international organizations like IMF, World Bank.
Oh,
Yeah.
can I? Oh, sorry.
Yes, Will, please.
Years ago, but my question is different from that. But it was more of like, we do realize, for example, Ford company has decided to change part of its operations to produce ventilators, for example. We have a very rich African companies and people, and I'm curious, like, we are going to work for those organizations, those companies, and how can we influence them? Is there a role they can play, and how, if we go there, how will we be able to influence that policy of like, can these companies be more responsible to take care of their own people instead of just taking profits from us?
Miasa, do you want to take that, or?
Yeah, I would like to take it. Is it okay? Yeah,
Yes.
I would think that these international bodies and this IMF and World Bank will, especially in this particular situation, maybe we have already experienced that the role of the medical professionals is very important, and they can provide more grants on fundings or grants or scholarships or public health scholarships or public health research on the nutrition, on the, for example, on the relationship of the people. So in order, or just building more health professionals, developing more health professionals in terms of human capacity or human resources, that they can be, for example, it will not be the case 1 doctor per 100 or 200 people, but it will be, for example, 1 doctor per 30 people or something like that in some of the countries. So this is very important, as we see that in some of the countries they show a shortage or lack of medical professionals, and their medical professionals are not so well qualified, even lack the equipment. equipment on one hand, but having the right knowledge is on the other. That's what I suggest. Thank you.
Okay, yeah, just to come in on the question. So I think, like as you know, the previous speaker will mention on the Defense Production Act, the one that allows the General Motors to, how to call it, to make something tailored to a major problem. I find for African governments or for the corporate sector in the African context, there is more that can be learned from the US experience, and some of it will also hinge on what are the local laws, the rules, the legislation that's available in the local context. Because, for example, a good number of international organizations have allowed their employees to work from home. So this is a very commendable thing that employees have been allowed to work from home. In other words, work remotely. But you also find that there are also employees who have been laid off. Some people have lost their jobs. So there is also that untold, that unknown number of people who have lost their jobs as a result of this health crisis. But again, like I said, the corporate world would have to see the response beyond just catering for their employees, which is kind of like their primary obligation or primary focus area, because after all, they're after profits, and corporate social responsibility might not rank very high. So I find the US experience very informative in as far as the corporate world in Africa is concerned. But again, much of it would depend on the laws in the country, whether something like that has been done before, or whether there are special provisions for corporate bodies to do that. And also, what will they get if they do that? Do they get tax breaks or something like that? So it's a much broader discussion that the corporate world would also need to be open to discussing and considering whatever options that will be coming out.
Well, just to build on to what Raymond is saying, from the I perspective, I think my take will be like corporate industries or organizations, what they can do is they have to go beyond their own comfort zone of like providing like sick leave or medical, benefit to their employees. But in emergency crisis like COVID-19 and whatsoever is going to come in the future, they have to have a close partnership with the government, with Ministry of Health, with the Center for Disease Control, to support them financially, to support them with, like, let's say, test kits for materials that they will need. And in turn, what the government can do for them is provide them, like what Raymond said, tax breaks, with setting kind of a discount allocation of, like, let's say, funding towards their operation in case if they have any financial challenges. So one is like, tax breaks, and then the employees working for them too, they can make sure has corporate bodies provide them with at least some savings. If you come in the context of the US, they have what they call FMLA, that's Family Medical Leave Budget, whereby if you have some sort of like health concern or medical issues, then the amount of money they are deducting from your paycheck will go towards, you can claim for that money, and it will go towards covering your medical expenses. Yes. So whether we have that kind of infrastructure in Africa or not, this is the question here.
So I'm interested in all the points that Will has been typing in the chat. It's very interesting to look at what are the corporates doing, and what are the corporate social responsibility. And to me as well, I'm interested to know about the international organizations and what they do. And I know, like Muyasser has talked briefly about it, but because I was looking into MSF, for example, like MSF, Oxfam, and most of what they've been doing so far has been good in the African countries. And they are basing their research on what they've been doing with the Ebola outbreak. So I don't know if you guys have heard from good practices that international organizations or international aid agencies are doing right now. I would love to hear more about that.
Yeah, thanks, Hadia and Muyasar. I was trying to type up what I was thinking as you were talking. I'm just gonna look up this blog that someone shared with me. It's a doctor who worked with the Ebola crisis and, has been in the continent for working on epidemics for 25 years. And part of this, just in a nutshell, what he is saying is solutions that they have found to work in Africa most likely would not work around the world, I think. And I think organizations that have experience working on the ground should continue working, doing what they're doing, and finding local solutions that fit the reality of the continent. I think importing new, lockdown measures and other, I don't know, I'm not a doctor, so I don't know what other measures they would try to use in villages and what have you, if those are impactful. The other thing is how much are they doing? I noticed the other day that WHO gave a bunch of masks, and is that enough? Do you need doctors? Do doctors who would come and respond to this, be the best help that the countries need? And so for me, it's which organization is best suited to give what type of help? So I don't know. It's a question for me. I don't have an answer, but which organization is best suited to give what type of support?
Exactly, Will. And I think it's just a very good time right now to reconsider our dependency, or the African countries' dependency on the international aid agencies. Just by at least just by witnessing what they've been doing and what they've been not. I know, for example, during the last week of Feb, I was attending a talk for the OHCHR chief deputy director, and he was saying that the WHO raised their funds was raised by 53% just in 1 week. So it's just going to be interesting for us as development practitioners, to reconsider how this funding have been allocating in different countries. And if we're talking now about informal economies, then we're talking about how people are depending on their own, how people are actually, that's also very interesting, that how they are on agriculture or it's just, oh my God. It's froze.
I dropped
It froze.
the call. Yeah, you were on.
Yes, Hadith is breaking down there. If anybody wanna be,
Again, I would love to hear from everyone, how we've been receiving the news from the international aid agencies to the African countries as well. Maybe it's now time to just reconsider the location.
I will say my opinion regarding international support and what is work. I'm actually just writing a paper right now on Unilever and its partnerships around the world, and I'm talking about how the partnership with WWF, which has been terrorizing Africans and Asians in their conservation, is a terrible thing. Is the best thing they can do if Unilever wants to be a nice company is find local community-based organizations that are doing some good work and partner with them because they have better solutions. And so for me, thinking about this, as development practitioners, as you said, if you're going to work for these foundation, or not foundation, but organizations, how do you influence decision-making to give more power to people on the ground who have been, probably have more effective solutions, and not just use blanket and generalized knowledge that, for each country, for example, or for all of Africa. I don't know if that makes sense to people.
is there anyone who wanna build on that point?
I want to talk more on corporate social responsibility. We realize that most I see that most countries and most organizations, corporate organizations, are doing a lot of corporate responsibilities. But I feel they're based on a short-term objectives that really we cannot rely so much on. Maybe we can think on corporate social responsibilities as an emergency to run to, because I know they usually come when there's an emergency and they hit in. But if we can be able to maybe talk as now development practitioners, talk to our companies to see to advise them on how to make long-term goals, because I'm so advocating on long-term goals, because I know they work better than just coming in for a short while and leaving. Because once you leave, then we go back to our problem. We go back to our issues that we still had. But if we look at long term, then we are able to manage and maybe come with solutions that will help us manage our problems better.
Well, just a bit on that one, I realize from the long-term perspective, my own take will be governments need to make sure they establish essential social service programs for people. Taking Gambia as a case study, they want people to wash their hands, but there's a huge disparity between the urban areas and the rural areas. Urban areas, they have like no borehole system, there is no water supply from the government. But if you go into the rural areas of the country, they don't have borehole system. They depend on well water, which is not even ready-made available in some part of the country. How do you make water accessible to your entire citizens? Whereby if you want them to wash their hands, at least they can go up on the tap, wash their hands, or at least they can have access to water to wash their hands. If you want people to go in for testing, do you have the testing facility? Do you have the testing resource in this country or not? If you don't have that one, how can we ensure our governments has development practitioners to establish Center for Disease Control and Prevention? How do we make sure we sensitize our the generations, or let's say the general public, about the importance of testing, so that at least they can come forward as ordinary citizens to go and be tested? How can we do that one? Do we need to rely on the media, like let's say on the TV, on the radio, and speak to these people in the language that they can speak and understand?
And I think as a development practitioner, then I tend to think that we need now to look at how do we bring our people to be part of our development agenda, the local people to be part of the development agenda, so that we have sustainability. Because if you look at my country, for example, there are many development agencies that have come in, they have brought water, they have brought boreholes, they have brought all that. But once the project is done after 3-4 years, you go back after 6 months, the borehole is not working. The people have gone back to where they were. They have gone back to the river. So as development practitioners, even as we are deliberating on this, then we should be able to think on, one, bringing the people into to be part of our development agenda, and then advocating for sustainability. Because what we are lacking as Africa is, as developing countries, is sustainability. We have all these structures, we have all these tools, but we cannot use them because we are used to depending on other people to do it. So if they're not there, then we cannot be able to do it.
Yes, can I come in?
Yes, Raymond.
Okay, yeah, just a thought which I just, it will be very interesting if African governments or the ones who are at the forefront of the response can revisit some of the items in their rule book. You know, we once had the HIV/AIDS pandemic at some point. And it'll be very interesting, from a health practitioner point of view, if some of the lessons that were learned or that have been learned in how governments initially responded to this challenge, to this threat, when it really hit African governments very hard. And I don't think, and I would want to think that the rule book is not being revisited. And also, it might be that some African governments are not prepared to write new ways to respond to crisis. Because if you look at it, like somebody mentioned earlier on, there's a general drag in terms of when governments actually decide to say, this is what we're going to do as a country. Because they'll be relying on the Western media or other sources which are outside of their own official channels. So it will be very interesting if African governments can, as a principle, learn from some of their rule books. In other words, the HIV/AIDS response. I'm sure countries have dealt with that, and some countries have dealt with it effectively, and they can translate some of the lessons to even new or emergent diseases such as the COVID-19.
Well, that sounds good. Do other folks want to have any other contributions?
Can I take us back a little bit to what Will's initial question about corporate responsibility?
Yeah, sure.
Yeah. Okay. So to answer your question, I don't know much about other African countries, but I know in Nigeria a lot of private companies, or at least private rich individuals, have been coming out with donations to support the government's mission to address this pandemic. I know UBA donated around $13 million, and different billionaires within the countries donated like $2.7 million each. There were a lot of them that did that. So I know private companies or private citizens have also been coming out in support of what the government is doing, and they've been able to help financially as well.
Thank you, that's great.
Yeah, that's fantastic. I think definitely in whichever area of development we end up in, we should, even where we work right now, I'm sure some of you have connections and networks, is like we are using this conversation to think about, or to think beyond what most people are thinking and what people should be doing right now and what we can do in the future. I think, for example, when I came in, you were talking about the disparity between who is getting tested and who is not, depending on income and exclusion. I did notice recently that if there's a drive-up testing center in Nairobi at a pharmacy, where you drive with your car and they test you and you drive off for $130. When you think about how much that it is based on like the income, income of Kenya. I think if you're in the urban population, for example, most likely the upper class, and not just the upper class, the middle class most likely will all get tested. $130 for most middle class in most countries is not a lot of money for them. They drink that amount of money. So I think what's happening for me that is scary is the middle class, who mostly influence, and the middle class, I'm including us in that equation, is we are the most influential, we are many, and we are happy to just like spend money and be protected, go hold all the food from the shops, from the supermarket, go get our testing done and be okay with this. So I think being able to influence people we work with and people we will work with in the future, for me, that is probably what I will take away mostly from this conversation.
Oh, Amaka, you have something to add, right?
Hello, Omar.
Yes.
Yes, it's Bertha. Can I say something? I want to find out. So this is a great discussion that we've had, and it's amazing the ideas that you all have and like the thoughts and what we have to do going forward and all that. So what's next? What's next for us right now? What do you intend to do? Because I feel like these are amazing and like great ideas that you have. I think that in my own way, as a media person, I'm just thinking you could write an article about this. You might not know who will read it, or we could do I'm just looking at you, like everything that you guys are saying is amazing, and you don't know who will take what from what at what point. So we could put together pieces of whatever everyone's idea is together, and then we could do a short video about it, or we could write an article about it and publish it. I think it would be a good thing, like about your idea, where we think we should go. It's good that way, like we are taking a step towards it, because talking about it alone is not enough, and we becoming aware of it and what we will do in the near future, or when we find ourselves there, is great. But I feel it's not enough. We have to also put ourselves out there to let people know what we are thinking as development practitioners, and what we feel it's right if they go about it that way, and to highlight some organizations that we feel are doing well and how we think it would have been better in other ways. That's my thoughts anyway. Yeah.
Well, I bet that's a wonderful suggestion or thought. So I think before the end of the discussion here, we will see how best we can try to come up with at least an idea or a strategy of putting all this thought together to synthesize it into, let's say, an article or something that can be shared with the general audience out there. Because initially the main idea was, how can we have different perspectives from the health background, from development background, from other perspectives. We all speak the common language to see what's our line of thinking about this issue we are having at hand.